So first of all, a lot of people, if they understand chiropractic for kids at all, they understand it in the realm of symptoms. My child is colicky. My child has ear infections, uh, reflux, constipation, and they bring their child in for those things. Maybe if they understand chiropractic at a little bit of a deeper level, they bring their child in because they're not crawling on time. Or that as they start walking, they're walking in an abnormal way and they think of chiropractic. And chiropractic helps with all of those things. It's almost magical because kids that have chronic ear infections, for my experience, my clinical experience, they clear up. No, chiropractic did not cure their ear infections. We cleared the stress and tension in their spine and allowed their nervous system to heal and repair, which is what your nervous system does. Okay? So we weren't actually treating their ear infections. We were clearing, aligning the spine, clearing the stress from the nervous system. Brain and body had a clear connection, was able to work better, and it does what it was designed to do, which was heal and repair. However, there's another layer to chiropractic that I really want to get out to people, and that is optimal health, optimal neurodevelopment. So your pediatric chiropractor, for the most part, I mean, I am in a program right now that's blowing my mind and taking everything I've known for 24 years to a whole new level with the way that we can, you know, heal these children and help these children from an early age. But so optimal neurodevelopment. So what a pediatric chiropractor like me will do would be to check my number one recommendation would be to check your child as close after birth as possible. Many moms come from the hospital to our office before they even go home. If it was a home birth, they're coming right to our house as soon as possible. And we're checking for any misalignments, any restrictions in the spine. We're checking their cranial system, their sacral system. If you've heard of craniosacral, we're removing any stress and tension from their muscles. And why? Because your nervous system is responsible for growth and development. We can find problems while they're small so that the brain is constantly firing and signaling at its potential, right? There are windows, critical windows of development, they're called, that within the first 3 years of life, when these windows occur, they open for a certain period of time and they close. Some of these windows are closed, never to return. There's a period of potential you have that you no longer, once it's gone, it's gone. So now think about this. Do you want your child's nervous system at its optimal level during those windows of time? I would think the answer is yes. I think every parent wants that. They just don't know chiropractic offers that, right? They kind of take the cross my fingers, hope for the best. They'll breastfeed, right? They know that's a healthier option. They choose organic food. All of those things are amazing. None of those things can clear spinal misalignments, right? So that is an area where I want to get out to moms and dads so desperately that here's another layer of healthcare that you may or may not have known. This is another tool in your toolbox. I'm not saying you have a pediatric chiropractor, you no longer need a pediatrician. I think you should have a healthcare team. Your pediatrician is there for if your child is really sick. We're there to keep your child so darn healthy to begin with that maybe they don't need those medications. Maybe they won't get those multiple ear infections and take, I mean, that's another rabbit hole, right? We can go down that road. I'll never forget, I heard a speaker one time say, we know chiropractors can help ear infections, but how much more amazing is it for the child that never knew of them because they had a properly functioning spine and nervous system from the beginning. That is so powerful. Every mom knows the pain and heartache, what it feels like when your child is not well. And so I'm not saying if your child gets adjusted, they're going to walk on water and fly through air and never get sick. In fact, chiropractors think getting sick, oftentimes not, we think getting sick is an integral part of building your immune system. I know that goes against the grain. And I think that if you want to understand more, then you should definitely follow me and our page and learn more, because if you understand that, you no longer will term, the coin germaphobe. You won't be a germaphobe anymore. You will understand the power of that and why it's so important to our survival and health and our future and our children. So chiropractors, we're looking for those misalignments early on, because a healthy nervous system will then go through those windows of development in a strong, powerful way. That will change. I mean, that can change the trajectory of your child's life forever. Just knowing to see a chiropractor in those first 3 years of life. But let's say I want to say this first. So then there's more like sensitive windows of development, and those windows that if they do close, they can still be reopened, right? So let's say you have a child who's 4 or 5 and you've never seen a chiropractor and you're thinking, is it lost potential for good? There's so many things that a pediatric chiropractor can do that I would not only check their spine for these misalignments, but I'm also checking certain reflexes to see if they're working properly. Because if they're not working properly, not only will we be adjusting them and making sure that their brain is firing on all cylinders, but then we're going to be giving you exercises for your child. Some of them are called neurological rehab. Some of them are just more muscular rehab, but ways to help your child move through them and work on weaker areas of the brain, strengthen them, and get them up to par, get them up to speed. So, seeing a pediatric chiropractor and being able to have your chiropractor work with them through their areas of development, their milestones, it's so impactful. It's so impactful. If your child doesn't crawl, that can affect their neurology in ways that you won't be able to see right away. They may not read well. They may have reading comprehension issues later on down the road. They may not like sports, and yet their potential could have been something athletic. But it alters and it rewires their nervous system in a way that just changes in the future. And so just making sure everything's working properly is so important. And of course, we want healthy kids too. So getting adjusted, I mean, chiropractic kids are some of the healthiest kids in the world, period. In the world. Just talk to moms who take their children to a chiropractor on a wellness basis, and they will tell you their kids don't get sick as much. My kids, 10 and 13, they've never taken an antibiotic. They've never taken a Tylenol. My 13-year-old 6 months ago took her first Advil because she got braces on her teeth and was crying from the pain. And so, of course, but the first one, almost 13, that's amazing.
That is amazing.
That's amazing. And it's not magical. We're not lucky. I say, we're healthy by choice, not by chance. We do things to build our health. The main narrative right now is not saying anything about building your health. It's telling you how to avoid sickness. And that's where I was years ago too. How do I avoid sickness? No. The conversation needs to now be, how do I build my health? How do I stay healthy and strong? And how do I get my kids healthy and strong from the beginning? How do we build healthy kids rather than fix and repair damaged adults? That's the question. That's the conversation.
Right.